Welcome back to the Microlearning Credential on Effective Healthcare Waste Management. This is Module 3 of the course. In this lesson of the module, we will look into the impacts of improper healthcare waste disposal on the general population and the environment. Safia, after understanding the hazards of healthcare waste in the hospital, was still not clear about its impact on the general population and the environment. She wanted to understand more about it and started discussing the same with her colleague. Let's understand what they discussed. Infectious agents can cause widespread diseases like typhoid, cholera, and jaundice. Therefore, increasing the burden of disease in vulnerable populations, and those living nearby to the waste disposal sites. For instance, patients infected with human coronavirus being treated at home are generating infected waste, possibly discarded as domestic waste, which can pose risks to workers and the environment, depending on the conditions of transport and disposal. Although there is no large literature or scientific evidence of widespread illnesses due to pharmaceutical waste from hospitals, there have been reports of leakage of biomedical effluent in waterways which has a large potential to damage the environment, wildlife and microbiome of the region. Leakage of certain drug waste like antibiotics into public sphere can cause development of resistant bacteria or superbugs. A case study of wastewater treatment plant in Czech Republic revealed that there was a presence of antibiotic resistance genes and antibiotic-resistant E. coli in the wastewater, due to the increased use of antibiotics in households and hospitals in the region. Genotoxic waste, if released into the environment, can cause mutational changes in any life form that comes in contact with it. It can cause physiological changes like degeneration of organs, changes in cell biochemistry, among others, that may or may not be inherited by future generations to come. A study undertaken in Finland found an excess of spontaneous abortions during pregnancy and malformations in children of women with a history of working with anti-cancer agents. Studies in Canada and the United States of America have shown similar results. Sharps include syringe needles, scalpels, broken glass and other objects contaminated with blood from a source patient. Health outcomes from percutaneous injuries include infections with hepatitis B virus, HBV, hepatitis C virus, HCV, or human immunodeficiency virus, HIV. When speaking of genetics, radiation is known to pose a wide spectrum of detrimental consequences. Radioactive pollution causes damage to DNA strands, which can lead to some forms of genetic breakup. The most common disease that arises in people that have been exposed to radioactive pollution is cancer. Other dangerous diseases that might be brought on by exposure to radioactive waste include anemia, hemorrhage, etc. Several accidents resulting from improper disposal of radioactive healthcare waste have been reported. One extreme case of Brazil demonstrated carcinogenic impact on the general population from an unintended exposure to radioactive waste from a healthcare facility. While moving to a new site, a radiotherapy institute left a sealed radioactive source in equipment at its old premises. An individual who gained access to these premises removed the sealed source, took it home and broke open the casing to reveal the radioactive material. As a consequence, 249 people were exposed, of whom several died or suffered severe health problems. Public, especially healthcare professionals and sanitary workers, face a variety of occupational hazards like exposure to chemicals, contact with toxic gas, accidentally touching infectious waste discarded from hospitals, etc., which increase the incidences of work-related disease, the country's burden of disease, the total number of accidents, the incidences of job-related health problems, and the number of cases involving incapacitation or disablement. This can affect the economy of the country, disturbing the labor market. Recently, COVID-19 has exposed health workers and their families to unprecedented levels of risk. Safia decides to go to the nursing head to understand effective waste management now that she has a better understanding of the types of healthcare wastes and its impacts.